Okay, so this is going to be the second episode of the Prime Healthcast. Today is all about teeth, in honor of me coming over and having my teeth done. So we've got Rianne, again we've got Karina, General Manager, and this is going to be all about teeth. Okay, so Karina knows all about everything about teeth. She's the expert.
I'm gonna kill you.
So we're going to ask some questions. Right, Rianne.
Right. I mean, usually patients ask a lot like veneers, what's the difference between veneers, implants, crowns? Could we talk about that? Could we explain?
When people first contact us and they just say veneers, they don't know the difference to what veneers, crowns, if they need implants, etc. So we then correspond with the dentist and we give the photographs if they're on any medication, any illnesses, because sometimes certain medications, diabetes, can affect the gums, you know, and then the teeth could start rotting and blah, blah, blah. We need to know this because they might not be suitable for certain dental treatments. But veneers and crowns in Turkey are classed as veneers. Yes, we know the difference, but they just call them all veneers. So the Hollywood smile, you're getting the veneers. A lot of people then, there's backlash saying they're not veneers, you got their crowns. That is explained to the patient when they're here. When you see stuff on social media, people just put veneers because it's a hashtag. It gets it out there a little bit better. But the patient themselves know what they're getting when they're here and they had a consultation with the dentist. Implants are needed. Some patients message me and say, I want implants, blah, blah, blah. I'm missing a tooth here. You know, they don't need implants. They can have them, because it's stronger if you get it to fill the hole. But a bridge is also an option. So implants, you need 2 visits, 3 months apart. So you'll come over, have your consultation, x-ray, you'll start prepping the teeth. Then the first part of the implant will go in, but you need the gum to heal. So 3 months later, you need to come back to put the cap on top. It's more expensive, it's a longer process. So there is always 2 options.
And it's much more
80%.
painful too, isn't it?
It's more painful, obviously, as well. The older people might need the implants more than the younger people. You know, if the gum is not strong enough, they also cannot be suitable. So there's a lot of stuff to take into, there's so many factors that when people smile, we can give them a cost, we give them a breakdown of what the dentist is advising, but when they get here, they could have an x-ray and there could be a lot of issues in the gum. So before anything happens, we will give the cost, the treatment plan, blah, blah, blah. Like, they know what they're going to get.
And again, cost is another big one. So say someone comes in and goes, I want to book in with Prime Health to get my teeth done. What's the cost? And this is why I always say to people, I'm like, you've got to actually consult with the dentist because we can't just give you a set price because it depends on how many teeth you're having. It depends on all of these different factors. So that's a big thing as well. How would you, if you had to give a rough cost?
Okay, so as you said, everybody's different and it depends on the treatment plan. It depends on, some people want to stay in different hotels. We work with certain hotels. If they want to stay, the price could go up in that as well. That's another factor. Under €4,000 would be 20 teeth. The Hollywood smile that they want. That's no implants. That's no extra treatments. As I said, it depends when they have their x-ray. If there's more work to be done. Obviously, if you're having a full mouth done, 1 root canal is included in it. They might, if anywhere needs fillings, they'll do that included in the price. But if there's anything extra, it will be explained to the patient that you need this done, you need that done. Some people need gum treatment. So that's an extra cost. But obviously, if they, some people will only come if they're coming with a companion. They, somebody's coming to have plastic surgery, gastric sleeve. Their husband comes and wants a filling. Their husband comes and wants the gummy smile treatment, anything like that. We can look after everyone, but if you're getting a full mouth of veneers or crowns, it can be added into that, it can be included in that cost, certain treatments, But the more you need, like some people, a smile, 20 teeth wouldn't be enough because you can see they might have a big smile. So it could be up to 26, 27, it all depends on the patient. So we can't advertise, come over and have a smile makeover for a certain amount because we'd be lying. We need to assess, you first, and then we'll give you the price.
A lot of the things that come up as well is, how come is it so much cheaper to get it done in Turkey compared to the UK or the US? And again, that's one of the, I always like struggle with that question. No, I don't struggle, but it just annoys me.
Yeah.
And it's just because it's almost like common sense. It's like, how can you not understand? It's just a different currency.
Yeah.
You know, you go over to China, that's where people get their clothes done in China because it's just so much cheaper. The cost of labor is cheaper. The tools are cheaper.
Yeah.
But, you know, let's just
as
expand a little bit more.
The dentists in Turkey, most of them, 80% of them have their own labs.
Yeah.
You know, so like I have family members at home that got teeth done in Ireland, but their teeth were sent to the UK to a lab and that brings the cost up. They don't have their own labs making the teeth, where here they do. So that brings the cost down dramatically as well.
Right. So that's another big one.
Yeah.
Yeah. And just like with all other surgeries that we've obviously spoken about, it's just the cost of labor. Like the cost, for you to pay a staff member
it's much cheaper in Turkey.
Yeah.
Yeah.
And it's the exchange rate is very, like, for Turkish patients, when you give that price, for them it's not cheap.
Right.
It's cheap for people that are paying in euros and pounds. Because it's actually, when you convert that to lira, for Turkish people, that's not cheap.
No.
Yeah.
Like the expense of living in Turkey at the moment is really high.
Really?
You know,
Yeah, it is.
it's the same as use at home now. Everything's gone up. Everything's very expensive. But it's just when people have an euro and pound come over and they exchange it into Turkish lira, they're like, oh my God, this is so cheap. This is for nothing. But it's not. It's quite expensive now in Turkey.
Yeah. What is the average salary? What is the average monthly salary in Turkey? I know it doesn't work with like an hourly rate, but sort of the average earnings for a...
It was increased in January, the minimum wage.
Yeah, and it's 17,000 lira.
Lira. What's that now?
Because that would be like...
So like a 400 quid or something?
Yeah, basically.
That's like £400?
It would be around that a month, yeah.
Oh, wow. Yeah. Yeah, but 17...
And rents, you can't find nearly anything under, like, I would say, like, that's 17,000 lira.
Yeah.
Rent-wise, you couldn't find anything under 10, 11, I would say now.
Nothing, no.
No,
Even
I
10,
mean,
11 would be like a one-bedroom.
A studio
Yeah.
apartment, like a 10, 11 one that we would find, actually.
Yeah.
But so, you pay, like, at least 10 for rent, so you just have 7 left in your hand for your own expenses, bills, food.
Yeah,
It's
your
when,
car,
like, with
everything's gone
minimum
up.
wage, it's impossible for someone to actually live
Yeah.
in Turkey now.
Like tourism, again, is a big thing in Turkey. You know, they depend on it through the summer because they haven't got it in the winter. So they need to be very busy in the summer to get through the winter with some jobs, you know.
I can't even imagine how people would last with 7 or 8,000. Like,
They can't anyway.
I mean, since we've been here, we've exchanged 8,000 twice, and it's been like,
See?
and you just spend it in the shop like on
Yeah.
nothing, and it just disappears.
Yeah.
Like, people can't go out and eat properly anymore.
It's a treat now for
Right.
the normal, you know, the
average, even the ones
average
that are
income.
actually earning more than minimum wage,
Yeah.
for them to like go out, not even every day, every week just once a day is actually luxury now, I would say, isn't it?
Yeah.
Yeah. Yeah, so it does seem like, obviously from people looking at it from the outside, they're like, oh, it's so much cheaper. It's like, it's actually not.
No.
For people over here, that's a lot of
It's
fucking
not.
money.
Yeah, you know, and then the opinions come in. For that price, you're getting crap put into your mouth. For, you know, they think because the price is lower,
Yeah.
everything else is going to be lower. You know,
Yeah.
it's not. It's like Turkey's known for dentistry. Yeah, people get the Turkey teeth and they go home and they look, you know, hair transplants, surgeries, everything. It's cheaper not because we're using cheaper materials. It's cheaper because
Yeah, the currency and all that
yeah,
stuff.
you know,
yeah.
you take all of that into account.
Yeah, the other thing as well with the teeth is almost like on TikTok, what you'd see is a lot of people, what's kind of like frowned upon is like the way people go about with getting their teeth, almost like where they look they just don't look natural.
Yeah.
And that's one of the biggest things that obviously with me, one of the first videos that I posted, people were like, oh, you know, almost like, you know, make fun of you and all that.
Yeah.
But the last one that I posted, when I actually got them done, they were like, oh, I actually look really nice.
Yeah.
Because I didn't go stupid. I didn't get him stupidly white. I didn't get him like massively big or, you know, just like look like piano keys.
Yeah.
And I think that's a big factor as well.
Some of them, like, you know, influencers, people, anybody on social media that come to get their teeth done in Turkey, they want the brightest teeth.
Yeah.
They ask for the brightest teeth, but yet they go with the cost. They go for cheaper places. So if you're going to choose a cheaper option, you're going to get cheaper materials, obviously. And then some of them come out looking like chewing gum stuck on their teeth. You know, it's not a good look. But then you have everybody at home tarnishing everybody with the same brush. You go to Turkey, the whole country, you're going to get those teeth. It's not, you know, do your research. Go to good places that have a good name and, you know, are not about, I don't know, just the cheapest stuff getting the people over.
And I guess it's like everywhere, like quality, there are different qualities.
Yeah.
So you can go somewhere and you could just get a bunch of shit, or, you know, you can go somewhere and get them done quite well.
Yeah.
And typically the ones that look good don't really get shown much because people don't really feel like they need to show them off or whatever. Whereas the people that obviously get taken the piss out of is because they
got taken the piss out.
Yeah.
And like they do have, like, as you know, you choose your own colour. So it's not like the dentist says, right, you're going to have this colour and it will be this.
Yeah.
The patients have the option to choose whatever colour they want for their teeth. So when they have like the white, very white teeth, and they say, oh, that's Turkey teeth, that's the patient's choice.
Yeah. No, I mean it is that, and I think a lot of the time as well, people will say, oh, no dentist is going to touch you in the UK if you've got these teeth, and it's like, well, actually, the prices in the UK, I'd rather, if something went wrong, I'd rather take a flight here. Even prior to me getting my teeth done, I've always said to everyone, I'm like, if anything happens with my teeth, I'm taking a flight, flying over to Turkey, getting them done over there. Like, you're not scaring me by saying, oh, no one's going to want to touch you in the UK. I don't want to go in the UK.
Yeah.
So I mean, it's just stupid expensive.
Yeah, the prices are silly over there.
I mean, I tell you what, they are starting to match a lot of the treatments over in the UK. Somehow, I don't know how, but a lot of them are starting to match the prices in Turkey.
With teeth, yeah?
Well, with teeth and with other stuff as well. Like, I think some of the kind of smaller procedures, like, I know the gynecomastia, that's about $4,000 to get that done over in the UK right now. Some of the other stuff, like hair transplants as well, they're starting to kind of creep up
Oh,
to...
really?
Yeah, I don't know how they do that. Whether they're just using cheaper products or I don't know. How would you, what do you reckon?
I mean, with teeth, I think it's totally different. Like just Karina said, you know, most of the dentists don't have their labs.
Yeah.
And like she just explained, you know, the dentists in Ireland, they sent the teeth to England. So that's like a huge cost when you look at it for them. So if they don't have the labs there, with teeth, it's very hard to, you know, actually come to the same price because the lab is the place that a dentist pays more. Most of their outgoing is to the lab.
Right.
Because the equipment, everything, they just pay them.
I'm sure there is obviously lots of labs in Ireland where I was speaking about, you know, but this particular dentist didn't. So his cost was ridiculous to get them done.
Or either they are getting labs done now.
Yeah, I'd say by now.
Maybe they're getting more labs done.
And they can match the prices from abroad then.
Yeah. So then, what are teeth made of? Because we've obviously got different types of veneers, different types of materials. So obviously we've got the Emax, we've got porcelain, you know, the zirconian. So what are the different types?
So veneers, when people say they're coming over for veneers and they get crowns. So veneers there's very little shaving down on the natural tooth. So there's less preparation in a veneer. They're very thin and they're placed over the original teeth. Not everybody is suitable for this if they have fangs, if they have a twisted tooth. You kind of need more straight teeth.
Right.
So they're given to patients for an extra bit of length, colour, and you know, that kind of a way. But where crowns, they cover the whole tooth, and it does need an extra bit of filing. So you're prepping the natural tooth that little bit more, which gives the shark look, kind of. Yes, some places file too much, and you know it doesn't have to be too much, But again, every patient is different. There might be something wrong with that tooth. It needed extra treatment, blah, blah, blah. The list goes on. But veneers and EMAX they're porcelain, so they're quite fragile.
Right, yeah.
So the likes of patients who grind their teeth, we'd be very nervous if they don't use their night guard. They could chip more easily. So where crowns are made out of is zirconium. So they're stronger, they're more durable, and they cover the whole tooth.
So that's not as easy to chip. Like you're going to
No.
struggle to chip that.
Yeah, you will chip them if you want to chip them.
Yeah.
But porcelain's like glass.
Yeah.
You know, very easy to chip. Where you do see a lot of patients, you know, they had porcelain veneers before and they come in and there's like bits gone out of them and blah, blah, and they want the stronger one. So when they come off, we need to prep their teeth down more.
Yeah.
And then they'll have crowns.
So how long do they last? Because that's another question. A lot of people have asked how many years are you going to get out of them?
So they're built to last, like you could up to 15 years, 10 to 15 years if you look after them.
Yeah.
Some people can have them for 30 years.
Right.
You know, it all depends. You need to, just because you get veneers or crowns or any kind of treatment, it doesn't mean you don't go visit your dentist regularly.
Yeah.
You still need to brush, floss, and have your, you know, every couple of months people go to the dentist.
Yeah.
You know, you still need the clean. You still need the checkups at home. And don't be afraid that you're paying that dentist for a checkup. You're not going in with any issues with your new teeth that you got in Turkey. You're going in for a clean and a dental checkup, and you're going to pay for it. Don't be afraid the dentist won't touch it, because they will.
So you can still get it clean?
You still get it clean. And we recommend you get it clean.
Okay.
You know, because it's oral hygiene at the end of the day. If you don't keep them, your gums will be affected.
Uh-huh.
You know, so if you don't treat your gums, if you don't treat, you know, your oral hygiene in full, you're going to end up, it could be receding gums. Smokers, you know, receding gums is going to happen to a smoker the older they get. The older you get in general, your gums start to get weaker. Your bones start to get weaker. People start losing teeth. So that's where implants come in. But then we have somebody who might have implants. 5 years down the line, they might lose the bone strength. They need to come back and they need a bone graft in their gum. You know, so oral hygiene is really important.
Yeah.
If you get
Can you stain these teeth?
It's like, they don't stain like normal teeth.
Uh-huh.
Okay, but they will shade down in colours over a year. I mean, if you drink black coffee and smoke like a hooligan, red wine, you know, it doesn't stain them, but over years.
So they can be whitened, or they can be...
Like they can't be whitened because they're polished. So before you get your teeth on, you know, you'll have a fitting before the final fitting, and you'll see if you like the colour.
Uh-huh.
When you decide you like the colour, once that it's polished, it's very hard to change the colour of the tooth.
Right.
You might get a tiny bit up, you might get a tiny bit down, whatever. But I always recommend when the patients come in, if they say, oh no, I don't want really bright teeth, but I want white teeth, I get them to choose the big Hollywood smile, because it's very easy to shade down. It's very hard to shade up. So even when the teeth comes and they're snow white, I explain to them, don't panic. Now see what suits you. Because some patients come in and say, no, I want really natural teeth. They come and then they regret it and say, I wish you were a shade lighter.
Yeah.
And it's very hard to do that, but it's very easy to shade down.
Yeah, and because you see a lot of people drinking from straws and stuff like that.
Yeah.
Is that...
You know, it does help. Like, as I said, if you drink really dark stuff, if you smoke acid-y stuff, you know, Coca-Cola.
Yeah.
Like, Coca-Cola can clean toilets. Imagine what it's doing to your insides and your gums and everything else.
Yeah.
You know?
Is there any other questions that you run into when people...
People asking a lot about companions coming when they're getting their teeth done. So, you know, with your package with Prime Health, we include transfers, your flights, and your hotel accommodation.
Yeah.
So if you want to bring a companion, there's no extra charge for transfers or accommodation, but you'll just buy their flight ticket.
Yeah.
We will require their booking deposit like your own. So, you know, it's €500 booking deposit. That's taken off your teeth costs when you arrive here. And the same again, another €500 for your companion to come. So we'll book the flights for your companion. If they come in at 300, the 200 is refunded when you get here, either off your cost or back into your hand.
Yeah.
But we'll book the flights for you. So the only extra is the flight cost of a companion. They'll stay with you in the same hotel room.
Yeah. That makes sense. Did we?
The only other thing is composite bonding.
Composite bonding, yeah, okay.
A
So,
lot of patients ask for that.
Composite bonding is essentially like
It's
Like a
it's
filling.
like a filling.
yeah.
So a lot of people ask for it, and like we're not the type of company that says, yeah, come on over, we do it for you. I'm very honest, and I'll say, you know, do you grind your teeth? Yes. Straight away, I'll tell you, don't waste your money.
Yeah.
You know, because it can chip like that.
Yeah.
Eating anything hard can chip. It's a filling. So you think of, you know, fillings pop out all the time. But if they're covering the front of your tooth, it's very easy for them to chip.
Yeah.
You know, so personally, I think they're
Don't really
okay for
recommend
some
it.
people to give them that little bit of length and straightness of their teeth. But they have to be very careful with them, and they have to use their guard at night time with them as well.
Yeah.
You know, but all of this is explained when they get here, because we have a lot of people who, you know, they could be a dental nurse, they could be, you know, their auntie's a dental nurse, somebody blah, 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 but it's cheaper here to get it done. They'll come over, oh, we know everything, you know, we know that they can chip, they can this, that and the other. So people take the chance on it to just look
They're
better.
much cheaper.
Yeah.
Are they?
They are. Because it's just filling.
Just filling, yeah.
They're not actually filing down the teeth, you're not going to the lab and getting a set of teeth. So it's actually basically, you're sitting in the chair and the dentist is there doing fillings on your teeth. That's it, basically.
Yeah.
The amounts are less.
We can say that's why
Works
he,
out
yeah.
cheaper, yeah.
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 But if you were to have,
More, like 20, yeah, it would be actually the same in the veneers.
right.
Yeah. But
But you'd only do the
bonding,
front, you'd
you
only
don't
do the ones
do
you
that,
see.
You just do the one you see, so it does work out cheaper because it's less teeth you get done.
Yeah.
And it's done in a day.
Oh, it's done in a day, is it?
Yeah. So we don't go back and forward to the dentist.
Uh-huh. So what about root canals? So when people get root canals done, or the how often do you get someone come over and they need a root canal?
Not a lot. Really not a lot.
Okay.
You know, some people might come with companions that have been told at home they need a root canal, but the price is super expensive.
Yeah.
So they'll get it while they're here. But other than that, wouldn't be a lot of root canals done.
Yeah. And again, it's not just veneers, crowns, you know, it's any dental treatment. So
Any
if you're-
dental treatment.
Let's say you need, you know, a root canal and
Yeah.
it'll cost you a fraction of the price over here. You can still come over here and
Of
get
course.
that done
Yeah.
rather than it, and not having to wait.
Even if you're here on holiday, you know, if you're in the area where we're in Kushadasi and we're in Izmir. If you're having a holiday in either area and you did need some fillings done, some root canals done, teeth whitening is very popular as well. A lot of the companions come and get the teeth whitening.
Yeah.
You know, anything like that is possible. You just contact us and then we'll arrange a day wherever you are. Come to the dentist, get your treatment, and you're done.
Yeah.
So there's no package involved. You know, you're already here. You say, oh, Karina, I'm coming on the 24th. Any chance of me getting a filling done? I've had that a lot. No problem. I meet them down to the dentist and they're
then
done.
They're done, yeah.
Yeah.
Yeah,
It's
yeah,
cheaper than at home.
Yeah.